All right. My name's Connor,
My name is Maria.
And my name is Jaden.
and our topic is on neurobiological changes associated with ketamine use and addiction.
Introduction. Our research question was, what are the neurobiological bases of addiction and how do drugs of abuse alter normal brain circuits? Addiction is a chronic disorder characterized by compulsive substance use despite harmful consequences, and it is associated with long-term lasting changes in brain structure and function. Current neuroscience views addiction as a brain disease because of repeated drug exposure alters neural circuits involved in reward, motivation, decision making, and self control. Ketamine is a dissociative anesthetic that has gained a lot of attention in recent years due to its very unique effects on the brain. While ketamine has showed rapid antidepressant effects and potential therapeutic benefits for treating substance use disorders, chronic use has been associated with addiction and neurological alterations. Research using neuroimaging techniques has shown that individuals with ketamine dependence exhibit altered activity in brain regions involved in reward process, executive function, and impulse control. These changes are correlated with drug craving and extent of ketamine exposure, suggesting that prolonged use disrupts normal neural functioning.
Okay, some ketamine background and history. Ketamine was first synthesized in 1962 by an organic chemist, Calvin Lee Stevens, as an alternative to phencyclidine, or PCP, for medicinal anesthetic. Later in 1966, Dr. Edward Domino and Dr. Gunter Korsen conducted trials with the compound on 20 humans, and the first official human dose of ketamine was administered in August 1964. In their findings, they discovered that ketamine was offering a unique experience that was proving to be a safer alternative to the aggressive and confused state that phencyclidine had offered. They coined this state dissociative anesthesia and significantly reduced patients' emergence delirium. Ketamine is now commonly used in general anesthetics, often in conjunction with other anesthetics like propofol, usually marketed as a racemic mixture of both the S and R enantiomers, with the S having a higher affinity to bind to the NMDA receptor and is often associated with less cardiac effects. However, more recent studies have shown that the R isomer can be more potent with less negative side effects.
Expected outcome and hypothesis. Hypothesis. Chronic ketamine use will produce significant changes in brain region associated with reward processing, decision making, self control, and dopamine signaling. These neurobiological changes are expected to cause addictive behaviors, craving, and withdrawal symptoms. At the same time, ketamine's effects on glutamate neurotransmission, NMDA receptors, AMPA receptors, and brain-derived neurotrophic factor signaling could explain therapeutic potential in treating depression and certain substance use disorders when given in controlled clinical settings. Expected outcomes. We expect to find that long-term ketamine use disrupts normal activity in multiple brain regions, mainly involving addiction, including areas responsible for reward processing and function. Neural image studies will likely show altered patterns of brain at rest activity that correlate with the abuse of ketamine use and drug cravings. Additionally, chronic ketamine use may affect dopamine signaling pathways, contributing to behavioral changes associated with dependence and withdrawal.
Okay, clinical trials and significant findings. Regarding ketamine therapy and addiction, researchers conducted a study in 1997 seeking to utilize this compound to aid recently detoxified alcoholics. 111 patients were administered regularly with 2.5 milligrams per kilogram dose of ketamine. 100 others were not, and followed up 1 year later. The results are remarkable. Roughly 66% of the ketamine group remained alcohol abstinent, and only 24% of the control remained abstinent. Those same researchers conducted the same study on cocaine users. Again, the results speak for themselves. 67% of frequent users either significantly reduced consumption or remained abstinent entirely. The review that investigates Krupski and Granenko's study also recognizes an interesting phenomenon: drug memory reconciliation. Reconsolidation. This is a concept of exploring how ketamine can affect the expression of drug-related memories. This is displayed in a trial conducted with rodents that were administered equal doses of morphine, and the rodents that were given a measurable amount of ketamine were less likely to return to morphine-seeking behavior. Ketamine is an incredibly interesting compound. It acts primarily as an NMDA receptor antagonist, which blocks a glutamate receptor that plays a role in memory, learning, and neuroplasticity. Research has shown that ketamine possesses an incredible ability to reshape unconscious beliefs and memories related to addiction. Another study conducted in Russia in 2002 involved 70 detoxified heroin-addicted patients, were divided into two groups, both receiving psychotherapy in conjunction. One group receiving a hallucinogenic dose and the other receiving a milder dose, to serve as an active placebo. The results showed that those who received the higher dose and were elicited the psychedelic effect produced a greater rate of abstinence within the first 2 years of a follow-up. One clinical trial conducted by Domino where patients' brain activity was recorded by electrophysiological cats. Their findings suggest that ketamine induces a unique pattern of brain activity. Unlike traditional forms of anesthesia like barbiturates or phencyclidine, ketamine provided a distinct dissociation between the thalamus and the hippocampus. These findings provide evidence that ketamine produces a unique experience in anesthesia rather than generalized suppression of brain activity.
For societal relevance, why this research matters. When we think about addiction, it's important to remember that it doesn't just affect one individual. It also impacts families, healthcare systems, and entire communities. One reason this research is significant is that the relapse rates for substance use disorders remain very high, even after traditional treatments. Ketamine is especially interesting because it appears to work differently from many existing therapies. Instead of only helping people manage cravings or withdrawal symptoms, it may actually help change the brain circuits and memories that contribute to addictive behaviors. If future research continues to support these findings, ketamine assisted therapy could become an important tool for improving recovery outcomes and reducing the long term social and economic burden associated with addiction.
Ethical implications. Research involving ketamine shows several ethical implications because the drug has both therapeutic potential and the ability for misuse. One ethical concern is balancing the benefits of ketamine treatment against the risk of addiction, dependence, and adverse psychological effects. While clinical studies have shown that ketamine may reduce symptoms of treatment-resistant depression and decrease cravings in individuals with substance abuse, researchers and healthcare providers need to carefully monitor patients to minimize the risk of misuse and long-term neurological harm. Another ethical issue involves informed consent. Participants in ketamine studies must be informed about the potential short-term and long-term effects of ketamine. This is including dissociation, cognitive impairment, and the possibility of long-term dependence. Researchers also have an obligation to ensure that vulnerable populations such as individuals with severe mental illness or substance abuse disorders are not exploited during clinical trials. Finally, ethical questions rise regarding access to ketamine-based treatments. Because ketamine has demonstrated rapid therapeutic benefits for some patients, restricting access may prevent individuals from receiving potentially life-changing care. But widespread availability without appropriate safeguards could increase the chance of abuse and addiction. Therefore, continued research is necessary to establish guidelines that maximize therapeutic benefits while minimizing potential harms. Ethical implications and safety will need clinical practice to remain critical as ketamine continues to be explored as both a treatment and a substance with addiction potential.
In conclusion, our research question focused on understanding the neurobiological basis of addiction and how drugs alter normal brain circuits, with a specific focus on ketamine. Throughout our review of literature, we found that addiction is not simply a matter of poor choices or lack of willpower. Instead, it is a chronic brain disorder that involves changes in neural pathways responsible for reward, motivation, learning, and memory. Ketamine is unique because it acts primarily as a NMDA receptor antagonist, affecting glutamate signaling in the brain. Unlike many traditional treatments, ketamine appears to influence neuroplasticity, which is the brain's ability to adapt and reorganize itself. Researchers believe this may help disrupt the maladaptive patterns and contribute to substance use disorders. The studies we examined demonstrated promising results. Patients receiving ketamine assisted therapy showed higher rates of abstinence from alcohol, cocaine, and heroin compared to control groups. Researchers also proposed that ketamine may alter drug related memories and reduce the power of cues that often trigger relapse. These findings suggest that ketamine may target some of the underlying neurological processes that sustain addiction. At the same time, there are still important gaps in knowledge. More research is needed to determine the optimal dosage, treatment protocols, and long term effectiveness of ketamine assisted therapy. Future studies will help researchers better understand exactly how it produces its effects and which patients may benefit the most. Overall, the evidence suggested that ketamine has the potential to become an important tool in addiction retreatment by improving our understanding of how addiction changes the brain and how those changes can be reversed. Researchers may be able to develop more effective treatments and improve recovery outcomes for individuals struggling with substance use disorders. And then for our sources, we used primary and secondary journal articles to make sure the information we presented about ketamine addiction and its effects on the brain is supported by current scientific evidence. And then these were just the sources we all used.
Thank you.
Thank you.
Thank
Yeah.
you.